Hello everybody, welcome back to part 2 of my health journey. I am going to start off this video with a disclaimer because I had a good friend, thank you Angeline, who pointed that out to me that I probably should have put it in my first video, because I'm not here to tell anyone to stop taking their medication or not go to the doctor, medical doctor. I'm just here to share my journey. I'm here to share what's worked for me. So with that in mind, here is my disclaimer. I'm just going to read it off my pad here. The content of these videos is not intended to substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. As I said, I'm only here to share my health journey and also point out where we actually do have choices that we can take in our health and pursuit of health. So with that in mind, last video I was talking about me training as a mental health nurse. This is what started me off wanting to pursue a career in wanting to help people with their health, because I was ill myself, as I said. I never actually worked in a psychiatric hospital because my experience of working in them as a student nurse really put me off the idea of wanting to work in a psychiatric hospital in England. I found the system to be very archaic and very little focus on helping people to get well without using medication. I saw people drugged up constantly and given very little talking therapies or alternative therapies. They do have alternative therapies there, but depending on where you are as well in the country, I just found the whole system to be very depressing, to be honest. But I've had a wonderful experience here in Switzerland. I have the pleasure of knowing someone who accessed mental health services not that long ago, in the last year, and I couldn't believe the transformation. This person went in a shell of their former self and came out, I think it was six months later, rejuvenated. The system here is really good. We pay for our medical insurance here, we pay a lot for that, but it was, honestly, it made me actually think about wanting to retrain here in Switzerland, because I'd have to do that to be able to work as a nurse here, because the transformation was amazing. If I could work in a system like that, where people actually are being helped to recover from trauma, absolutely amazing. So it's lovely to see that these places do exist, where people are helped to get well from their mental health issues. Not just treating the symptoms with medication, but actually treating the person as a whole, holistic services, which is why I ultimately subscribe to. But yes, so getting back to my disclaimer, I'm not here to tell people what to do, but I am here to empower people to recognise what they do have control of in their life. Yeah. So I'm just going to refer to my notes here to keep me going along on the right track, because I tend to ramble. I've noticed, I've recognised. So excuse me for that. I'm going to try and keep it succinct. Yeah, I have to say, just a really good movie to watch if you haven't already done so. I think most people have watched it. Is Beautiful Mind. I love that movie because it's a movie that really takes you on the journey of being the mentally ill person, because there's a very fine line between when someone starts to go off the path of mental wellness into mental unwellness, and that movie takes you on that journey and helps you to see what it feels like to be mentally ill, where you're not actually aware of the person slipping into that state because they're taking you on that journey, so you're going through it with him. And that's exactly how it is when you start to lose your marbles. You don't know you're losing your marbles, so the audience doesn't know for a while until you're like, oh, hang on a minute, he's not very well in the head, he's seeing people and hearing voices. So it's a really good movie to watch, and looking into that character, I forget his name now, It's interesting what they did with the movie, because they made it out in the movie as if he was taking the new neuroleptic drugs at the end, when actually if you look up his story, he didn't actually take the new neuroleptics, but they kind of have to say that in the movie that he did. But he didn't, and he learned how to manage his mental illness without the medication, because the effects, the side effects are so debilitating for people on mental illness drugs, that they can't think, they can't function, they can't perform sexually, they put on weight, there's so many side effects to taking these drugs, and he wanted to be able to do it without the drugs. Obviously, the doctors don't like that, but we do have a choice. Just like we have a choice whether we want to have chemotherapy for cancer or not. Ask doctors personally themselves, would they have this treatment for themselves? You'd be surprised at the answer. But it's just that we aren't offered anything else. And so I'm not here to slate the health system. The health system saved my life when I was 19, because I would have died of my illness, probably. I'll never know. But I was severely ill. And it did save my life at the time. And in emergencies, hospitals are brilliant. They save people's lives. They do amazing things, especially, operation-wise. I've had operations myself. And they're brilliant. But I'm talking about chronic illness. I'm talking about long-standing illnesses. I was told that I would never be able to come off my medication. And that brings me back to my story. So the reason why I didn't want to work in the mental health drugs is because I just would feel like a drug pusher. Like I was just doling out medication. And little else in many places is being offered to people, because it costs money to have talking therapies. It costs money to actually rehabilitate somebody, to give them the skills to be able to cope with life, with what they've been through or what life has thrown at them. It takes money, and I guess the health service is not always up to that. So, yeah, it's a difficult one. Yeah, so when I was given my medication for my autoimmune disease, it got to a point where I was just getting sicker and sicker and sicker. And I would go every 3 months to my clinic appointment to see my doctor, who was a lovely doctor. She was a really nice doctor, and she really cared and wanted to help people, but she couldn't do anything else for me. And when I didn't get to see her, I remember seeing a different doctor, different consultant, and he would just say, well, people with your illness, they work. People work with this illness and have quite normal lives. And I remember just coming away feeling so dejected and so depressed, because I'm an active person. I love being busy. I love working. I love the satisfaction that comes along with that. And for me to hear that, it just made me feel so rubbish. And I just went home and I just cried. And I cried on my way home from the hospital because I didn't feel good enough. I felt there's something wrong with me. Why can't I work? I remember giving up my last job that I had, where I actually went off permanently sick. And because I was pushing myself so that I could keep working, because I was hearing this all the time. I shouldn't be so tired, I shouldn't be so lethargic, I shouldn't have these symptoms that I'm having. But what happened with me, with my vagueness, is that I got nerve damage in my left ear. And this nerve damage, the closest I can describe it to is if you're going scuba diving. Anyone who's ever been scuba diving, and when you have the breathing apparatus, and the breathing, you can hear your breathing really loud in your head. This would happen, my ear would pop, and I would get this loud, I would hear it's as if I could feel my breath going in and out of my ear. It's extremely sensitive, and it would become painful, and plus I would feel dizzy, I would feel woozy, I would feel sick sometimes, and I would get these terrible headaches and ear pain if I didn't lay down flat completely. If I laid flat, wherever I was, not always possible when you're out and about, when you're trying to work, if I rested for long enough, it would correct itself, and then I would be able to get up again. I would feel like really tired and woozy and just like really heavy-headed and exhausted. And I remember going in my last job, and this would keep popping based on my activity level. It would keep popping, and I used to go into the toilets, the ladies' toilets, and I would put all paper towels on the floor and I would lay down in the toilets. And that was just awful. That was my life. It's either that or give up my job. And I don't want to give up my job, but I had to in the end because I couldn't keep doing that. I wasn't getting any work done. I laugh, but it's not very funny. It was very depressing. Anyway, yeah, so the alternative, the option that I was given by the doctors is, oh, here you go, have a wheelchair that will help you get around. Your husband can push you around. So that was the solution. Anyway, that's the end of this video. I'll have to do part 2 again because the time. See you in the next video.